Okay. So the plan is this. Okay, we go down there, we get the call center. Now, there's only 50 people down there. We're not going to stop there. Okay, we're going to see how many people, because I'm talking to a few people in Florida that have access to a lot of agents. So I'm going to try to recruit these agents while I'm there and get them in that class. So it'll be more than 50. Now, why am I doing that? Because up here, because of the RSSA, I have put together a team of professionals that have hundreds of clients each. And what we're doing is we're creating this team. I don't know if I explained it to you, Susan, but we're creating these team of professionals to be able to take care of people from the point that they're ready, not only from the time that they retire, but we want to get people like 50 years old. Okay, 50, 55 years old with 10, 15 years to retirement. Because what we're going to do is we are going to service those people every year. We're going to reevaluate everything for them because things change. They sell houses, they lose their jobs, they get jobs, make more money, make less money, yada, yada, yada. Okay, so that's something that needs to be done like Medicare every year. And it's something that they suggest every year, but Social Security doesn't help you analyze it. They just let you do it on your own, which is where we come in. So before we send out these emails, like I could send out 200 emails to my clients right now. And out of those 200 emails, there's no way that I'm going to be able to handle the business that we have coming in. And there's physically, it's impossible once we get these 8 other professionals to send that letter out to their clients. We're going to need people to be able to be taking phone calls, not to mention the advertising that we're doing. So my goal is to have enough phone calls and enough appointments booked that we're booked working solid every day, no matter how many agents we have. And the thing is that we're licensed and appointed in 5 states right now, me and the agency, Michigan, Ohio, Texas, Florida, and Michigan, Ohio, Texas, Florida, and Georgia, is it? Florida, Texas, Ohio, Michigan, Georgia, one of the other ones. Anyway, um, so we're going to need a lot of agents. We need to set it up too because we're going to be dealing with people over the phone. Now, I was an agent for Assurance and I was able to work from home. I was on a time clock. It was no different than being in an office in a cubicle. I had to sign in, had to sign out. We're going to have the same system on because we need people working, especially if we're paying them what we're going to be paying them. So, that being said, any questions before we get started? And again, also is that we want to do these trainings Monday, Wednesday, and Friday. I'm recording them now. And I'm repeating it because Michelle just got here. I'm recording these trainings so that you guys will have the tools necessary so that I can be on the road and the trainings can keep going, with new people coming in. So I'm thinking that within the first month, or we start with these 50, I'm going to recruit a lot of them. Like I said, I'm a closer, so I think that I got this handled. Um, so we got within the first month, I'm hoping another 25. If we can walk away with 100 people on the phone, will it be enough? No, but it'll be enough for us to start making some serious money. And every dollar, and Lisa's not here, but anyone who knows me can attest that for the last 3 years, I haven't taken a paycheck because every dollar that I've made, I invest back into my company. It's what's gotten us here. So I feel the same way. Like that's not going to stop. I want to get big quickly, and we have the tools and the people to be able to scale this quickly. So that's what the plan is. Okay. I also, just so you know, this RSSA thing right here, I got to learn how to do it. There you go. That way. Okay. That way. All right. So the RSSA thing, I want to get I can get a deal on putting 10 people through that program. Okay. The RSSA costs $3,400 a pop, but I'm negotiating a very, very decent deal to get at least 10 people in because I can't tie up my day doing Social Security analysis. I'm registered now and I will do a lot of them. I'm already starting to do them, but we need a lot of people. Now, why is that so important? Because, like I said, people that come here with their Social Security, they tell us where all their money is: 401ks, life insurance policies, investments, CDs, the home equity. We know what their debt is. And those are all things that we have services in place to help them for real estate, mortgages, taxes, etc. And then, of course, Social Security and Medicare. So we are the Walmart. That's what we're building. Okay. Questions before we move on? I'm going to put the easy method and everything back in there. Michelle, make sure you download this. It's going in the chat right now. That's the easy method. And then we have the complete sales process, which is the easy method explained. You guys have that, put it in your MEPAL folder. And what we're going to do first, we're going to open up the easy method. And if you guys can open up both of those documents, that would work best. If you could open up both of those documents on the screen side by side, because I'll explain it as we go through it. Any questions before we get started?
No questions.
No? Okay. Michelle, you all right? You good? You're on mute, though.
That's why you can't hear me. I'm like, I'm good. I'm good.
Okay, good. Okay, so let's start with the easy method, okay? And I'm doing this again, Susan, for your benefit because this is how we sell Medicare. This is the only way to do it. The enrollment process takes an hour and a half. An hour and a half, okay? That is to do the job properly, to do it to the point where your clients don't call you because there's no reason to call you because they have the insurance, it works, they know how to use it. Okay. That takes an hour and a half. What we're going to be talking about today in this training is all about everything that you have to do to save every moment you get, because every moment you get, once you start hitting that 1.5 hours, 1 hour and 45 minutes, your clients will start yawning. 2 hours, now all this information is starting to get jumbled in their mind, and it starts confusing them. So my goal is to get them in and out, not confused. Okay. And I tell them I tell them all the time, you don't have to remember everything that I'm telling you. Don't remember it. Okay, I'm just explaining it to you so you get a general idea of what this is about. But you need to understand that it doesn't matter what you remember. The only thing that you need to remember is that we know what we're doing. Don't worry about you. We know. Um, so if you have any questions, that's what we're here for. Don't worry about remembering. I did an enrollment on Saturday. What I do is I schedule a call 3 weeks down the road. Okay, 3 weeks down the road, 7 to 10 days. By law, they have to have their welcome package and they have to have all the documents and their cards and everything ready to go in 7 to 10 days. And we're going to explain that when we go over an enrollment. But for now, it's about saving time. Easy method. All right. I'm going to do this real quick. It's going to be on a recording so you can listen to it later. So we're not going to worry about explaining things too much. All right. So easy method. All right. And all it is a bunch of E's with a couple of Z's at the end. That's why I call it the E's. I tell people when I'm training them, selling is easy. It's so easy if you know how to do it. So here we go. Engage. All right, what does that look like? Mr. Jones, Bobby Keogh, Emmy Pound Insurance, how's everything? All right. And I taught Rick this. There's this word called everything. If you're from New York and you call someone, hey, how you doing? That doesn't sound right. But you cannot mess up, hey, Bobby Keogh, how's everything? It sounds like perfect English. And that's what we want to do. But when you engage someone, you got to engage with enthusiasm. When do you have that enthusiasm? It's not when you pick up the phone. It's not when the client picks up the phone. It's before you pick up the phone. You have to be in the right mindset to be able to communicate with people, especially over the phone and especially in person. Okay. And the way you do that is by being absolutely committed and focused, and you need to know why you're doing this. All these things are going to come together later on. Okay. So we engage with enthusiasm. I'm enthusiastic. I'm ready to go. Then it says evaluate. Okay, so this is what it sounds like. Hi, Mr. Jones. Bobby Keogh, getting back to you from Emmy Powell Insurance. How's everything? You have a moment that we can speak to? Is that okay? You'll see me do that all the time. I ask for permission for everything 2 or 3 times. And people, why? Can anybody tell me why? I'm asking them permission to do simple things?
To make sure they're on board with you and that they hear what you're saying.
No. Next one.
For
Anybody
me,
else?
it's
Come
to
on.
keep them. For me, it's to keep them engaged.
Okay. Susan, any ideas? You're on mute. Here's this thing. Where is she? Let's see. Susan, you're on mute. Let's go down here. Take this. Okay. Uh, it's to get them in the habit of saying yes.
Oh, okay.
Yes, that's okay. I am asking them for their trust that I'm not going to scam them. I'm asking them for their permission because I respect
Oh, I get
that
it.
they
I know. I get that now for sure.
okay. And that's why I do it, and I will ask for permission and say, is that okay? Are you all right with that? And I do it all the time. Listen, no pressure. I just want to make sure that you're following along with me. Is that okay? Is that okay? Is that okay? And it's like, yes, yes,
Yeah,
yes,
it
yes,
makes
yes.
them feel safe.
Right. So now, Mr. Jones, how's everything? How's it going? How you feeling today? I feel like shit. That's evaluation. Okay. So you need to know where you're going depending on how they respond. So you're going to evaluate their response. And you'll be surprised at what you'll be able to do. Like, ask me how I'm doing, Rick, on the phone. Ask me.
How you doing, Mr. Allen?
I'm doing all right, Rick. What's up? What did that tell you?
You told me you're not doing very well in
What
so
else did I
many
say?
words.
What else did I say?
I'm doing all right.
The one thing that you need to focus on, it was that huff right there says, I get so many calls. Here's another one. They got me again. Do you understand?
Okay.
It's about the emotion that the person's feeling over the phone, not what they're saying, because I don't speak to people with words. I communicate with their emotions because people don't make decisions based on logic. They make decisions based on feeling.
Excuse me.
Can you check in, huh? I've got an appointment.
This is not Henry Ford. You're looking for Henry Ford?
Yeah.
You got to go out those doors outside
Uh-huh.
and to the left.
Oh, okay.
Out that way through the hallway. Yes. All right, that won't happen again. I locked the door.
Okay, it's okay. Yeah, well, they'll ring the bell. It's all right. So anyway, so what we do is we communicate with emotions, especially with people on Medicare, especially people with health insurance. They're coming to you, they're frightened, they don't know anything about it, they don't trust you. I've had people sit down and the first thing they say is, I don't trust you. First thing they say. I don't trust insurance agents. It's a big scam. And what do I? So now I'm evaluating that. So what am I going to do with this person that goes, it's me. Yeah, what's up? What am I going to do with that?
Gain their trust.
Well, I'm going to say, hey, listen, Mr. Jones, I totally understand. I hear the frustration in your voice. And believe me, I'm in an industry where I understand perfectly. You get a lot of these calls. But all I'm going to ask you for, the only thing I'm going to ask you for is to allow me to ask you a question. Okay? The question is this: do you think that there is a remote possibility that out of all the calls you get, that maybe one call could be very different, and that would be a call that would be of benefit to you? Is there a remote possibility that this call might be of benefit to you? Well, sure, it's possible. Well, let me tell you something. I'm going to guarantee that it's going to be if you just give me the shot. Okay. And that's what I do. All right. So notice that I evaluated where he was. And the next thing on that easy method is what? Empathize. Empathize. There's more than one way to skin a cat, they tell people, right? You've heard that before. More than one way to skin a cat. A friend of mine a long time ago told me that there are two ways that you can skin anything. Anybody know what that is? I've said it before. Write it down if you don't know it. Kindness and empathy. Those are the two things. And I'm going to share this screen so that we can follow along with it. Okay. You guys see that, right?
Yes.
Okay. So we engaged with enthusiasm. We evaluated the person's state of mind. We empathized with it. Okay. So let's say that the guy says, "Oh man, I'm doing great. How about you? What am I going to do? I'm going to empathize with that. Oh my God, I am so grateful, sir. You know, I have no complaints. I'm glad to be doing what I do for a living, and wait until I'm done, you'll understand why." Right? So I empathized with it. And then, okay, after you empathize, then you set the expectation. The expectation is, hey, listen, I'm a licensed agent, and I am going to, I'm just going to ask you a few questions. And what you're doing is you're setting the expectation. There's not going to, I'm not going to force you into anything. I'm here to do one thing. I'm here to make sure that you have the plan that has the most benefits for the least amount of cost and risk. That's what I am here to do, and only that. It doesn't matter to me whether you enroll with me or not. I don't care. The only thing that I care about is that by the time you and I hang up this phone, by the time you walk out of this office, that I know that you have the best plan available for you at the lowest cost, at the lowest risk, with the maximum amount of benefits available. I do that, and I've done my job whether you enroll with me or not. That's the expectation. Okay, now if we do find a situation that might be better than what you have now, we'll talk about it then. But for now, let's just see what's available. Sound good to you? Is that okay? Right? So now you just set the expectation. Now you're going to educate. Now it's time to educate. Okay, so Medicare gives us, the ability to take a look at your Medicare account. We can't change anything. But what we can do is get information that we need to do our jobs properly. Okay. So what I'm going to need are the first three letters and numbers off your Medicare card, right? Do you guys still see the easy method?
Yes.
Okay. Let me stop that. All right. Let me share this. Okay. Share. Okay. I'm going to say, you guys see CMS right now? Yeah, right?
Yes.
You guys see the CMS? Okay. Here we go. Let me sign in.
Medical payments 1,000, 800 disability account.
Okay. Here we go. Here we go. Nope. Copy. Copy. So now I'm going to say, Mr. Jones, let me just pull up. So yeah, okay, I'll do it with him. Okay. All right. So this is Marks, Marx. Okay, Marks. This is CMS.gov. This is Medicare's database. Please take a note, and I am going to put it in the chat. All right, in the chat. Where's the chat? Okay. This is cmsportal.gov. Susan, do you have access to this?
Yes. Well, I do on the regular side. I don't, this is be interesting so far on the Medicare, but
Oh,
yes, I do.
okay,
For
you
the
do.
regular health
Okay. Well,
insurance
you do this right here, right? That's what you
for the
did to
train.
get your
Yes.
right.
Correct.
Okay.
Yes.
So this is something that I have to get you access to because you can
Okay.
only have access to the Medicare database if you are an agent or an agency with authority from one of the carriers that you're with that allow you to sign in. So it's a process, but it takes a minute, but you get it done. So let me show you what this is. This is by far the most important tool. That's what I'm giving you today, tools. This is the most important tool that you're going to have for Medicare because it's going to tell you everything you need to know. Okay. So we're going to go in here. Beneficiaries. Okay. All right. Here's what I'm going to do because I'm going to be recording this. Rick, do you mind if we use your information?
No, go ahead.
Okay, perfect. All right. So what's your date of birth?
7846.
With this system, you have to put that / 708.
Yes.
All right. Now, if you don't have, see here, it says 3 characters minimum. If you put 3, you got your Medicare card?
Yeah, I'm going to get it here.
Here's what happens. A lot of times people don't have the Medicare card, or it's in the it's in their wallet, or they forgot where it is. That's when you can use the whole Social Security number. Okay, the whole Social Security number, which is something that people are trained not to give out to anybody. That's usually the biggest hurdle that agents have. I get the Social Security number 100% of the time. Why? Because I
Okay, you
tell them,
ready?
yeah, go ahead.
Okay. 5 Golf Mike 4.
That's all I need. I need 3 numbers. And right now, I'm giving you the basics. We haven't done the enrollment yet. There's a process to the enrollment, which we're going to go over. Okay, and what I do is if they don't have their Medicare card, I tell them, listen, there's only one other way, just like Medicare, there's only one other way that I can access your account. Okay, and that's through your entire Social Security number. Now, I don't want that information yet. I want to explain to you about what I'm going to use it for. We don't store that information on our computers. This is going directly into Medicare's database. We will not store this information without your permission, and I don't need it right now. All I need to do is take a look at your account and see where you're at. Remember that this call is recorded, and these records are kept for 10 years as per Medicare's guidelines. So you need to understand that I'm not going to sell this information. You are as safe giving me your Social Security as you would be giving it to the Social Security Administration or Medicare. Plus, I could say this, and I hope you guys are too. I'm a registered Social Security analyst, which is recognized by the IRS and the Social Security Administration. So you have nothing to worry about. Is that okay with you that I put your social into the database so that I can take a look at your account? Is that okay?
Yeah.
I haven't had anybody say no. You guys have seen it. Nobody says no. They just spit it out. It's all about context, and that's why, remember, I told you it's about answering objections before they come up. I am addressing all their concerns before I'm asking them for a piece of information that's perhaps the most private and the most heavily protected information that beneficiaries have. Okay? So, this is what you'll see. Am I sharing the screen? Yes?
Yes.
Okay, so this is the information that you will get. Okay, you got to have first, last name, and date of birth. If you get any of it wrong, it's not going to work. Those three letters, you got to get it right of social. Here is the claim number. That has nothing to do with you. The MBI number, Medicare beneficiary number, is right there. A lot of times people don't have it. They haven't gotten their cards yet. I tell them, take a piece of paper out. You're going to write it down. You're going to fold it up and you're going to put it in your wallet, and that is going to be your Medicare card until you get the physical copy. It's just as good. All right. So, what am I doing? I'm providing a service. They don't have a card. Now they do. Why? Because of me. Okay. So, there you go, Richard J. Now, you said Richard Whaling, or I said Richard Whirling. Now is when I would say, do you have a middle initial? Because
Yes.
remember something, we are recorded, unless you're in person, we are recording this over the phone, and we need to follow HIPAA. HIPAA is making sure that before we talk about their plan, that we have the right person on the phone. So you have to verify this information right here before you go any further. Okay. Date of birth, you already know, because that's what got you here, your mail. All right. I have your, or I could say, what is your address? Sometimes they'll give you a different address that's here. Oh, according to Medicare, it's always according to Medicare. According to Medicare, the address they have on file is this one. Did you move? All right, and the
No.
most, no, I know you haven't, but this one right here is the most recent county, which is Wayne. You need to know what county. The address has to be right because the only plans that you can get are the ones where they are residents. Now, if this person is coming from, let's say, North Carolina, all right, you're going to tell them, listen, we're going to fill out the application with your new address here in Michigan. It's going to be sent to Medicare, but that's not going to change your address everywhere else. You need to go on Social Security or contact Social Security and have them change your address on the master list. The master list. That list will go to all federal agencies. Okay, master list. And sometimes you call Social Security and they don't know what you're talking about. And they're the ones in charge of it, okay? So now over here, you'll take a look at, this is the enrollment information. So here's the contract number and the PBM, okay? Provider, benefit, whatever plan. So I want to show you something. If you highlight these numbers here, right click and hit search Google, it's going to come up with the plan. Q1 Medicare, by the way, Q1 Medicare is a very good site. I don't trust anything I see that isn't from Medicare, the actual plan. However, for a quick glance at the plan, Q1 Medicare is the one to go. And here you'll have all the information that you just got from those 7 numbers, okay? So now you're going to come here. It'll tell you everything that you need to know about the plan. Okay, where it's located, the plan ID, there it is right there. All right, you can contact Medicare, that's nothing. It'll tell you the premium, it'll tell you that any benefit Part B deduction or give back, it'll tell you the deductibles, it'll tell you everything. The only thing that it won't tell you is down here, a lot of times they've actually gotten better about it because usually they don't give you the dollar amounts. They've changed that recently. All right, but it does tell you everything. But you see, like the emergency 110 copay, I would not be telling the people on the phone or in person about this plan coming from here. I would only do it coming from the actual evidence of coverage. Like I said, do not trust this as being accurate information. You're going to get accurate information from where?
Uh, Q1 Medicare.
I just said it. Where's the most accurate information about your plan, Rick?
On this Q1Medicare.com.
No, hell no. I just told you you can't trust it.
Oh, I thought you said this was the only one to trust. Well,
Do
Medicare.
not trust. There's only one place where you can get the information about your plan that you can absolutely guarantee that it's accurate. Where is that?
CMS.gov?
No,
Then I don't know.
dude, the evidence of coverage for your
Okay.
plan. Your evidence of coverage. That's the only information that you trust. The one that's coming directly from the plan, not CMS, nowhere else. Evidence of coverage, EOC, or the summary of benefits, SOB. All right, that's the only place that you go to get accurate information. You don't even do it through Sunfire. You do not trust Sunfire because these are not the plans. These are third-party quoting tools. Can you guys see Simply Enroll?
Yes.
Give me a date of birth, Rick, one more time.
7/8/46.
Oh, you're not coming up here. You're killing me here right now. Oh, because we went through Trinity. That's not a good example. Let's just go here. Here, let's just do this. All right. 48187.
48187.
And then you go up here as a quick, this is a quick way to do it here. Just click view all plans and it'll get you to all the plans in 48187, as you can see up here. Okay, so now I'm going to go down here. I'm going to pick Trinity Health. All right, I am appointed and I am going to put the one with the give back. There's the cash back. There you are. You go to details and this is plan documents and there it is, summary of benefits, evidence of coverage. If you open up the evidence of coverage, all right, this is 225 pages. Okay, 225 pages, but it has every benefit in the plan. And this is the only time that you tell people about what benefits are in their plan. You cannot tell them from any place other than the evidence of coverage. The reason that I'm being so stringent about this is because you need to understand that in Medicare, there's something called grievances. Okay? You don't want to be on a recording giving somebody information that you're getting from a third party and not directly from the plan. That's when you start having trouble with CMS. In the 500 enrollments I've had in the last few years, I have had 2 incidents that were grievances, and because of the recording, they were thrown out and found to be unfounded. In one letter, they actually told the person who complained, get out of here. Get out of here. You know, this guy did his job and he did it properly and you thanked him for it profusely. And now, like I said, what my thought is somebody goes home and their cousin's uncle, sister's brother says, oh, I had that. That's a horrible thing. You better get out of there. I'd file a complaint with CMS. You shouldn't have that plan. And they have no idea what they're talking about. And a lot of times people do disenroll and they go into something else. And Rick, you've seen it. They
Yep.
literally financially murder themselves by doing that.
Terrible.
We don't enroll people in plans that aren't in their best interest. End of story. And that's what keeps you out of trouble. Here it's going to tell you the plan. It's going to tell you what type of plan it is. It's going to tell you when the plan started. Immediately under it, it will tell you the last plan that they had, which was a prescription drug plan. It started on 125, ended in 130. 2025, which is this year, but it ended because you started the new HMO. Here is the enrollment information. It'll tell you when they got Part A. So when you're giving somebody a Medicare card and they're writing it down, you're going to take your Medicare number, then you're going to say hospital Part A effective date is this. And in this box here, you'll see if they are getting a free Part A or if they have to pay a premium for it. Usually people who don't meet the requirements of 40 quarters paying into Medicare are the ones that you'll see that they'll have to pay a premium. Down here is Hospital Part B. Hospital Part B started February 1st, 2025. You'll see yes, currently entitled, premium is payable. Okay. Now, usually it'll just say currently entitled. When you see premium is payable, it means that they're paying more for their Part B than someone else because of the Part B late enrollment penalty. That's that information right there. Eligibility information, this is for Part D. Part D started 1/1 of 2013. Hasn't ended, okay, because you're still on it. But what you can see is that there is no late enrollment penalty here. All right, let's go here. This is for incarceration. All right, enrollment periods. Let me show you this here. What you'll see here, and it's not here, is that there'll be a start. It'll show you the previous enrollment. I'm sorry, this right here is for people who are not lawfully present in the United States. I got ahead of myself. Right down here, number of uncovered months. This tells you, like, you see, this is your problem, Rick. This is why they're not taking money out for your extra premium.
Yeah.
You see how it says number of uncovered months? You
Yeah.
have 13 years worth of uncovered months, which
Is a nightmare.
you should have that right there. Number of uncovered months should be 156.
Okay.
So trust me, keep putting that money away because they're coming for it. Employer subsidy, this is when an employer pays for their health care. You don't really have to deal with that. There's only two more things that you really have to pay attention to for now, and that's the election type code. This will tell you what has been used to enroll into the plan. Okay, so you didn't do this for OEP. This was your initial enrollment period, so you didn't use that. You don't have a quarterly LIS SEP. Susan, how much do you know about SEPs? I know we have them for health insurance marketplace, but there are 27 seven of them in Medicare. Do you know about that?
No, only only regular side, not
Okay,
the Medicare side,
there
or what
are
they all are. I thought there was only two, so that's very interesting. Yeah, okay.
Yeah, there's 20 between 24 and 27, and it changes because now they just did a disaster SEP for Florida. All right. They do them for New York, they do them all over. So you're constantly having now there's one SEP that's extremely valuable because with all the changes this year, people aren't allowed to enroll every 3 months like the way they used to. Can't do it anymore. Now they're stuck in their plan until the end of the year. There's only one way for you to enroll somebody who's outside of the enrollment period, and that one way is called chronic special needs plans. Okay, people with diabetes, heart conditions, cancer, end-stage renal disease. It doesn't matter what month, it doesn't matter what day. They are allowed to use that special enrollment period once per year. Okay, so that's why it doesn't matter that we're out of the open enrollment period because there are so many different reasons why people can enroll, and which is why we stay busy even in the dead period. We're taking people on. It's constant. People come in here, they're out of their enrollment period, and they're like, I just moved. That's an SEP. I just got denied for Medicare. That's loss of coverage. Or denied for Medicaid. That's a loss of coverage. I just got Medicaid. That's an SEP. There's 27 of them. You'll learn them as we go. That's all there is to know about marks and cmsportal.gov. Any questions about this particular tool? Any questions?
No.
No.
It's pretty simple. What's that?
I said no, not for me, because I don't get to see it yet.
Yeah, well, no, I know. Susan, but this is just the tool that you're going to use. And as you can see, there is a ton of information on this small little page. Okay. So that is how we are now educating. Let's go back to here. You guys see the easy method again?
Yes.
Okay. So there it is. We set the expectation. We educated them. Okay. We're educating them about their plan. Okay, this is what you have. So here's what we're going to do. Okay, we are going to find you the plan. We're going to, we're setting the expectation. We are going to look at all the plans and we're going to compare this plan that's on here in CMS, and we're going to compare that plan to every plan available. And if you're in the best plan, I'm going to tell you so. You're going to leave here and I'll call you in October. If we find something that's better, we'll take it from there. Is that okay with you? Yeah, okay, great. So now we educate, okay? Um, we just educate them. This is what we're going to do. Now we're going to evaluate, and this is the needs analysis. Now, while you're talking, you're working. You're doing your stuff. While you're talking, you got to be able to multitask and because you're going to need all these things open. And especially if you're writing hospital indemnity, which you should with every plan, you have to have two things open. And any time that they're talking and you're listening, you got to be setting up and getting those applications, on their way. Applications, we also, while we're doing that, this is the agency block software. We're putting all their information in there. We're putting in notes. This is where their policies are going to go. This is where their activities are going to go. Okay, if you see, this, I just enroll him. The activity is for 4/29, which is about 3 weeks. It's called document check and education. We're going to make sure that they have all their documents, going to make sure that they have their cards, and we're going to educate them on how to use their plan so they don't end up with unexpected medical bills and denied claims. And they also know how to get all the benefits that they need. So what we're doing here with the evaluation is we're finding out, what do you need? What are your expectations? Your doctors, your medicines, okay? That's what you're doing. You're saying, do you need dental, vision, hearing? Do you have any surgeries that you're worried about coming up? How are you feeling overall? Things like that. But that's just small talk while you're putting all that information into Simply Enroll. You're putting in the doctors, you're putting in the medications. Medications are simple. You'll learn this as you do it, and the more we go over it. But simply put, it's the medication. What's the name? You don't have to type in the whole name. That takes too long. Remember, you have to take advantage of every second. Okay, so you put in 3 or 4 letters of the medication, and guess what? It comes up. You pull it. Now you ask them, what's the dosage? A lot of times they don't know. That's why you tell them before their appointment, bring a list of your doctors and your medications. Okay, so now you take the dosage. It's, let's say hydrocodone and acetaminophen. It's, 10-325s. When you see a medication that's 10-325 that has 2 numbers on it, the first number applies to the first name of the medication. The second number applies to the second name. So hydrocodone acetaminophen, 10-325 means 10 milligrams of hydrocodone, 325 milligrams of acetaminophen. That's how that works. Okay. So you're doing their medications. You got to ask them. People don't know how to talk health insurance. You have to know how to talk health insurance. All right. Without using terms like, who's your PDP? They don't know. Okay. Or who's your PCP? What is that? Your doctor. Make it simple for them. What's the name of your doctor? I need his last name and the town that he works in. For example, right? Making it easy. For example, Dr. Washburn from Dearborn Heights. Okay, got it. That is how you're going to be able to pull up the doctor. You're going to pull up the doctor, and it's going to tell you what locations he's in network, what locations he's out. So you have to say, where do you see them? Is this the correct address? They'll say yes. Okay, great. Your doctor's in. Medications, again, the name of the medication, the dosage. How many pills do you take a day? Don't make it up. Don't assume anything. How many do you take a day? I take one every day. How many pills is that? 30. You always shop and you always quote for a 90-day supply. You want to get them possibly into mail order because mail order works and mail order is more affordable because a lot of times for that medication you get a break for getting it 3 months up front. In some cases, they give you 3 months for the price of two. They're not going to get that at any CVS or any local pharmacy. Okay. So then you tell them, okay, and you got to be quick on your feet. Have a calculator. I have a calculator on my desk because the guy says I take 6 in the morning and 6 at night. So that's 360 a month. It's about saving time because there's a lot to do and you want to get them done and you want to get them on their way. That is what they love the most about this. They come in, we do our job, they leave, and it's over. That's the attitude. Okay. Needs analysis. So now you got the doctors first, medications next. That's all there is to know about medications. You save it in the enrollment tool. What's next? After the doctors and the meds, that's when you ask them what's important: dental, vision, hearing, transportation, over-the-counter benefits. Every plan comes with a fitness benefit because it's about preventing sickness, not just healing people when they get sick. That's the whole thing about preventative care with Medicare. All right. Any questions so far? I know I'm moving, but I'm covering everything and it's going to be recorded. Any questions so far about any of this?
Nothing right now.
Okay. Needs analysis. So now the next thing, do you have that? Now that we have the doctors, the medicines, we have everything they need. I need glasses, I need dentures, I need this, I need that. We have all it in there. Now we go shopping for the plans. So let's bring up the plan real quick. Go over the plan real quick. And you'll learn how to do all this. This becomes second nature. I've done this 500 times, so that's why I make it look fast. Do not rush. Do not rush. Rick was doing a quote the other day, rushing through the medication. The quote came up like $6,000 for their meds. That's what'll happen. You don't want to scare people like that. So you want to avoid doing a mistake like that because what you're doing is you're causing them stress. And stress is not a good way to close anybody. All right. Especially if you're wrong. Then you look stupid, which is not good either. All right. Let's go here with Trinity. Okay. You know what? Hold on a second.
Hey, Bobby, I have a quick question. When you were talking about those meds there, do you type them in when you're trying to find out if everything's covered to make sure they've got the right one, or do you so you can
See?
type them in? Okay.
Yep, and there it is. Dosage. What's the dosage? 10 milligrams. Quantity 3. I take 2 a day. That becomes 60. Refill is every 3 months. These are generic medications. So yeah, so then you're gonna add that. All right. And you see I had a mistake here. Okay, so I gotta add the medication, add another one. Let's go. I misspelled it, right? Listen, okay, just a few things. A lisinopril, let's go 5s, 3, let's go 3 months. And we're going to do 90. That's one a day for 3 months. Add medication, save pharmacy and medications. Now, what'll happen is if you look here, see two drugs covered, you click here and it tells you what you're going to pay at any one of these. You want to stay with preferred. Standards are going to be more expensive in some cases. The reason that these are 0 is because they're generic. Okay. Now you could also change the pharmacy right from here. And you can say, I want to go to Walgreens. Okay. All right. See preferred. If you want preferred, Walgreens isn't gonna be it. These are all standard. This is because it's Trinity. You wanna go over here, it'll show all the closest ones to the address that's in the system. So you go Ford Road and you come down here, you hit Save Pharmacy. And now if you look at this up here, it'll say Walgreens now, and it'll show 2 medications. Doctors, okay? Search by doctor's last name. A lot of times they don't know. You got to use Google and you got to be quick about it. Do not sit there waiting for them to remember. Start asking them the questions. Where do you go? What's the name of the office? You know? And so what I'll do, what's the doctor's last name? I put that in there, right? Nothing in there. Let's go 50 miles. All right. That's not coming in. This is my doctor. There he is. So it's last name first, okay? So Dr. Ali Naif, there it is. That's the doctor, okay? It'll show that he's a primary doctor, not the person's primary doctor. He is a primary doctor for internal medicine, family medicine, okay? Then you have the 7 more locations, and there you go. It'll give you all the locations. Make sure that the location that they're going to is going to be here. And a lot of times now, if you do this, you saw that, right? Now, did I save that, doctor? No, it's not going to come up. You got to go to the carrier site. So let's just go here. He's not in the network. Okay, he's not in the network. That's why he didn't show up. If I just say, let's say, forget about Trinity and let's go to anybody else, zing. Oh, I didn't save him. So let me put him in here. Now that I saved him, I know he's not in Trinity, but there he is. Okay. This little box here in green means that the doctor's in network. However, you just saw it 7 locations, but guess what? You see? He's not in these locations. So if the person that you're speaking to sees him at one of these locations that are in network, that are out of network, over here you just see in network, don't make that mistake. You got to find out which location he's going to take that insurance at. Understood? That's very important. All right. Ask me how I know that you can make that mistake.
Because you've done it.
It only takes once for you to look stupid, for you
Hey,
to never make that mistake again. Go ahead, Susan.
Quick question. So a lot of times doctors may not be registered with certain things and they'll say, yes, they are to the client. So do I still say, no, according to this, I want to make sure you're cleared based off of this is what it says they cover here, but they don't cover at this other location. Do you kind of explain that to make sure, even though the
No,
doctor's office says yes, or what?
no. What we do is what I'm going to show you right here. Boom. Google Ali Naif. Boom. There he is in Dearborn Heights, right? There he is. You could go here and you can see your doctor. And a lot of you come down to here to the federal, to the board or Corewell Health, wherever they are. A lot of times they'll have what insurances they accept. Okay. But most importantly, what you want to do is you want to go to the locations. Right there's all the information, primary care right there. And then you just call the doctor at the location that they're at. And you speak to the billing department, not the receptionist. You speak to the billing department because the billing department is the one that's sending the bills out. You get them on the phone. Hi, do you take Zing? Does that doctor accept her at this location? That's how you make sure. You have to make sure. Did that answer your question? You're on mute. Can you guys hear me okay?
Yes,
Okay.
I can.
Yeah, I hear you.
Okay. Okay, good. Okay. So there you go with the doctor. So now we have the doctor and we have the prescriptions come down here. WellCare. This doctor's popular, so he's gonna be in in virtually every plan. Let's see, Zing, he's in Zing, I know that, it's beautiful. Zing is getting popular. Zing is is a chronic special needs plan. Okay, yeah, you see over here, he's in 4 network locations. You gotta make sure. That's all there is to know about the doctors and getting the doctors right. And you just have to know how to get in touch with the doctor, how to find the doctor a lot of times, and you just gotta be quick. You have constantly gotta be looking at that clock and saying, I'm running out of time. Because the enrollment process alone, if you're doing it over the phone, takes half an hour, 35 minutes to get through the whole enrollment process. Okay. So you got to get the analysis and everything, and you got to get them to agree that this is the plan that they want as quickly as possible, which is why you need to know how to use your tools, and practice will make that happen. So let's just keep going here. Now, we're not going to go through the enrollment, but we go through the details. Let me just go. This is the plan. This is all the details where you have all the expenses, everything you're going to go over. We're not doing an enrollment today. We're not doing an enrollment today. We'll do that another time. But this is where you're going to get all the information. The only thing that I want to point out here is this right here, drug cost details. Okay. Drug cost details. You have got, if you are on the recording and you do not do this, they will reject the enrollment. You have to cover certain things, okay? So over here, we're going to say, okay, this is what it says it's going to cost you. Monthly premium is $27. There's a $420 drug deductible. It excludes tiers 1, 2, and 6. And then it shows you the medications, and it shows you what tier they are, okay? And it shows you if there's any quantity limits. You're not allowed to get more than 30 tablets for 30 days here. Here, lisinopril has no quantity limits, okay? And it tells you the tier, and it tells you the estimated full cost for the drug on a monthly basis. This is 1 month's supply, okay? Now you're going to come down to January, and it's going to tell you the totals for the month. 0, 0, 0, 0. And then you go through each month and you let them know what it's going to cost for every month so that they are fully aware what it's going to cost them for the year. And now you've become compliant. Questions? You understand that? Simple stuff. To me, anyway, because I've done it so long. You tell me any questions. Rick, any questions? Michelle?
No, I just want to make sure you got to go through every medication in every month and show them what it'll cost them.
You're just gonna tell them. You're gonna tell them there are 5 different tiers of drugs. Okay.
Yep.
And you don't have to. And all you have to do is tell them your atorvastatin, because you're gonna come through here first. The list of drugs. Your atorvastatin is a tier 6. Your lisinopril is a tier 6. All right. Your monthly cost for your drugs are going to be 0 for January, 0 for February, 0 for March. But remember, you're going to have 16, 17, 20 medications sometimes. So you can't spend all the time going through each individual drug, which is why you just cover this. You know, there are 6 tiers of drugs. Okay. This was a tier 6. And especially this. You want to tell them there's a $420 deductible. Anything that is not a tier 1, 2, or 6, you have to pay $420 before the insurance company will start paying for those drugs. Okay, that's the deductible. And then you just go through here and just tell them, like the people now starting in April understand something. They're starting their plan in April. So you cannot give them January, February, March, because the first time that you get your drugs is when you're going to pay. Usually the first month. So now you have to adapt it. And then this number here, the estimated drug cost, this is 0 because they're tier 1s. But this monthly cost, this annual cost will change if you start the plan in April. So that's why you tell them if they're starting in April, you're going to tell them how much it's going to cost as if they were starting in January, because that's their initial cost. So I would say, okay, let's say if in January it was $56, now we're in April. This says 0 because he's already out of his deductible phase, but I would still say, okay, so it's going to be 56 for April, 0 for May, 0 for June. July is going to be another 56, and that's how you do it. You'll learn more about this as we go on. Okay. But that's just an overview of how we do this. Again, we're going to do an enrollment where it's going to be a complete enrollment. I'll do it over the phone. I'm sorry, I'll record it so that you guys could just watch it a few times, and you need to be very familiar with this. If you guys follow what I'm telling you here, you'll be able to enroll somebody without any problems ever. All right. So that's the drug cost details. So we're done with that. All right. So now, next step, enroll. We're going to do the enrollment, right? Now, you ask them, so what do you think? Is this the plan? Are you good with that plan? Do you want that plan? Do you want to enroll in that plan? You know, yes, I do. Okay, great. So now we set the expectations for the enrollment. What does that mean? Let me show you. When you hit the enroll button, okay, everything that's in blue, you have to read word for word, especially if you're on the phone. I kind of like layman terms it when I'm here with somebody in the office, but I still go like this. It's important that you understand because I tell them expectations. Everything that you see here, I have to ask you word for word. It's the law. Okay. So I'm just going to read this, just answer the questions as quickly as possible, and we'll get done. I'll have you out of here in the next 5 minutes because that's how long it takes if you get good at it. Okay. And they'll just say, okay, yeah, could we review the benefits one more time? If you hit that number, that button, now you have to check it off, everything all over again. Click, click. Your Part B, your medical deductible, your drug deductible, your hospital coverage, your hospital observation and stuff. You just go through all of these. You cannot move forward unless you click. And these are all the preventative services. We'll go over that again when it's to the enrollment. You have to click all of these. And here are the tiers, okay? Here are the tiers. You tell them this is what you're going to do. You're going to go preferred generic, tier 2 generic, preferred brand, non-preferred drug specialty, and specialty care. So let's go like this and like this. We did all of this. It made me a liar, okay? So do you understand the benefits included with this plan? Yes? All right, and next. And now it's going to take you. You're going to fill this out. It's going to have all the information. And as you can see, I'll show you when we do this enrollment. Okay, you hit next, it's not going to let you go forward, and I'm not going to waste my time doing that right now. But that's how you get to the enrollment process, right? So now you enroll, you set the expectations. I'm going to get you out of here in 5 minutes. Now, after the enrollment's done, okay,
Can I ask a quick question though on that, Bobby? It said
hit
power
me.
of attorney. So let's say it's for their parents. Do you have to put the power of attorney in before you finish everything or what?
It will tell you. Yeah, it'll tell you.
Because I
It'll
saw
tell you.
the tab where it said power of attorney. So I was just trying to
Which one? Where?
go back up right next to that says applicant says power of
Yeah.
attorney.
So if it is someone with power of attorney, you would just do that because they're the ones filling
But
it.
that's got to be put in at the same time. Am I correct?
Yeah, like if I'm dealing with someone who's a power of attorney, I already know that. So as soon as I open this up, that's the first thing that I would click would be power of attorney. Good catch.
Okay. Okay.
Good catch. And then look at this. Remember, everything that's highlighted, you have to read. Okay. So to confirm, only a documented power of attorney can complete an application. It can't be the daughter unless it's on the phone and he is giving you permission on the recording that she can help him, or she comes into the office and he says, or she says, yes, my daughter can help me. Because ultimately, the daughter, the son, they're not signing. The beneficiary is going to sign in that case. And the son or daughter, if it's on the phone, we're going to send them a link through text and they're going to fill it out over there. I don't know who's filling out what. But all I do know is I have it on the recording that the beneficiary told me, yeah, it's okay. You understand?
Yes. Thank
So
you.
even with the power of attorney, the beneficiary is still the one that's going to sign it.
No.
Okay, that's what I
Power
thought
of
you said.
attorney is power of attorney. Power of attorney is as if the beneficiary was going to sign.
Okay.
But if there is no legal document, then you have to put applicant and the applicant has to sign. And like I said, you're going to send a text message to a 90-year-old person. Trust me, they're not going to figure it out, but their 50-year-old son is going to do it, and is going to sign her name. And that's none of my business. I sent the link to the beneficiary to the phone number that I was told, and it was completed. That's all that matters.
Okay.
I don't want to know nothing, okay? And there's no reason to. We do it like this all the time. Perfectly legal, but the daughter cannot sign the application unless she, in fact, has a document that makes her power of attorney. Okay.
Got it.
So now, expectation for now, after you get the enrollment done, now the enrollment is done, expectations for the follow-up. Listen, here's what's going to happen. This is by law, you have to do it. Listen, in 7 to 10 days, Zing is going to send the information to Medicare. Once Medicare approves it, they're going to put it in the system, and they're going to let Zing know that the application is approved. Then Zing is going to send you the documents, the welcome kit, and your cards. All this has to happen by law in 7 to 10 business days. So what I'm going to do is I am going to set an appointment with you right now for 3 weeks from now that I'm going to call you up. 3 weeks, that's 10 business days. We're going to make sure that you have your cards and your information. We'll go over the benefits one more time. So don't worry if you don't remember all the benefits. That's what the 10-minute phone call 3 weeks from now is about. It's about educating you on your benefits, reminding you of the benefits that were important to you, how to get them, how to avoid bills, and that you got your cards and you're all set up. That's the follow-up. Any questions? Now, notice that expectations for the follow-up, zip up the clothes. That's it. You're done. Any questions? And you shut your mouth. Answer any questions they have and get them the hell out of your office. How's that? So it took it a little longer than it would normally take, but remember that I told you, we went over a lot more than just the enrollment. But basically what we did is I could have pretty much done an enrollment in the same amount of time that we've been on the phone. And think about all the extras and stuff that I added to this, okay? Any questions?
No.
All good? Okay. So you have that. I'm
Sorry,
gonna
I couldn't
close.
unmute. Sorry.
Okay.
Is there going to be like I'm like a hands-on person. You could tell me everything and then I got to go play. Is there going to be a place where you get to kind of practice a little bit, just any of that during any of the training and stuff? Or is it pretty much when you're there, you're in?
Wait, what do you mean? I don't
So
understand.
like right now, you just went through and put in, but it's your actual site, right? Is there going to be like for training agents or anything like that, like a practice one to put in? You know what I
Oh,
mean? Like,
yeah. Oh, yeah. No, well, actually, what happens is you're going to start, and I would suggest that you do it now. Not yet. You need to be contracted. As
mhm.
soon as you step on board, we will have, not those, Medicare doesn't allow it. But what we do is we get them registered with Marks so that they get access. But I
Okay.
do have trainings. Like, for example, this is one of our trainings. All right. Right. Uh, registering for marks. We have these documents. All right. And I go over them. We need to change this to EmiPow, but this is basically step-by-step process to get registered. As a matter of fact, do you want this? You should have this. I'll give this to you.
Okay. Yeah, yeah. Thank you.
Where'd you go?
Was that your question, Susan?
Yeah, because that's going to give us that practice or whatever it is from there. Yes. Because that's what it does on the regular site. Yeah. For regular health insurance.
Right. Well, I have everything that we need. There's a lot of stuff that I have, but everything that where is it?
And once I get finally going 100%, that if I have questions on that, then we could either come
Oh.
up with something or see what we could do.
You know, this is nothing. Like this is this much right now. You know, so we're going to be going through a whole bunch of trainings. Oh, this is not right. Nope. We have to go over the phone disclosures and stuff like that. All right, but this is, okay, that's where it is. Hold on, let me close that. This is access, Mark's access. Here we, oops. It's in the chat right now, okay? And this will tell you exactly step by step. And then, yes, we're going to have practice sessions. I have full trainings with PDF documents where we set breakout groups and people practice among themselves and they come back and we evaluate. Yeah, it's a full 100% covered training to take somebody from knowing nothing to turning them into an agent and a closer in 3 weeks tops. But they have to do the work. So when I give them this, they have to, go and register for marks. I don't want to have to explain how to do all this. All right. And what you're going to do is the one thing that you need to be able to access marks is going to be this right here. That. It's not going to be that number. That is the number that you get from the carrier that gives you your role with marks that allows you to get access. So you'll get all that. You'll get all that. Let me pull this up. All right. I sent you this document. Everything that we just went over is pretty much word for word in here. So everything that we went over, everything, evaluate their needs just for yourself. There it is. Information. There it is. Educate. You're going to find out what their doctors are. Their current, everything is in there. Everything is in there. I didn't put this in detail because that's pretty much what I said. The expectations for the enrollment, because we've already, do you see that here? Do you want to enroll with it? Now that we found, and I tell them it's the end of the 3rd degree. We're done. No more questions. Now that we found the plan, do you want it? Okay. But there it is right there. And we're going to go into this with a little more detail when we're training. Remember, Susan, Michelle, Rick, you're going to be in those trainings virtually. Okay. And the one thing that we'll want to do, Rick, is we'll have to figure out, Michelle and Susan, that since we are the leaders of the company, we need to figure out how to get our cameras properly done. Because, Rick, you look like Swiss cheese. Okay. And we want to,
Well, I was going to ask you about that, and I don't know why.
I don't know
I
why
do.
either. We'll figure that out. Let's not take time to talk
Yeah.
about it now. Any
Right.
other questions? We're going to call it a day right now. Any other questions? Susan, you might not be here Wednesday or Friday, but I'm doing the trainings because I need to have these recordings done.
Okay, so you're just going to send them to me then?
Yeah, yeah.
Okay.
Right now
Great.
that this is over, I'm going to stop the recording now. And after it downloads.